Welcome back to Blueprint to Heal. I am really excited to have Dr. Sharon Gorman on today to talk to us about chiropractic. She is kind of like a superwoman of chiropractic. She manages three practices. She's an international speaker. She does seminars, and she's still practicing as a chiropractor after 30 years. That's like I'm so blown away by you. I
It's actually over 40 years.
40
Man,
years. Okay, you
40
need
years. You must be reading an old bio.
well, it's on your website, so you need to update your
Oh, I better
website.
check that.
Yeah, 40 years. And like you don't look a day over 40. So how do you do that?
I get adjusted regularly.
That definitely
Uh,
helps.
and also, at this point, I practice full time, which for me is 25 hours a week of patient care, and I don't run other offices. My retirement is taking care of patients. That's my great love.
Yeah.
Always has been. So for most of my career, I was like a business person and trained over 100 doctors, and I've had 7 offices. But for the last 7 or 8 years, I just go to work and I make the donuts. I tell the story and I turn life on in people. I adjust people. I love it.
It's funny you say that because for me, the hardest part about being in practice was always running the practice. Like to me, my joy was, you know, adjusting patients. And that was always a struggle for me personally, to even manage one person. So now I'm not in practice at all anymore, and I do miss it. But tell me, how did you decide to become a chiropractor? What led you to become a chiropractor?
I had an uncle when I was a little girl, like really little, became a chiropractor before anybody knew. I thought it was had to do with cars, a chiropractor. I had no clue. And he opened an office. I probably was 7 or 8 years old. And my parents and my brother and I would go to the office and he would adjust my parents because they had back pain. Everyone had back pain, but my brother and I didn't. And he didn't really understand the whole big picture of chiropractic. So I didn't get adjusted when I was real little, but when I was 10 years old, and this is a long story short, I got real sick. I had mumps. It turned into encephalitis. I was in the hospital with a high fever, and they were doing, spinal taps, and they couldn't get the fever down. And my uncle, very long story short, came into the had gone to a DE seminar and was, really kind of got the big picture of what chiropractic can do. That it's about the nervous system, not about your back. And I got my first adjustment in the hospital when I was 10 years old.
Wow.
So, long story short, I lived, I got well, and I was a chiropractor by the time I was 22 because I just couldn't wait. I couldn't wait to get my hands on people. I couldn't wait to get chiropractic to the world. I really felt like it was my mission, like I was on fire
Yeah.
at 10 years old. I can't even remember when I actually made the decision. It was almost like that's what I am.
Yeah, I think most chiropractors were led to become a chiropractor because we've had some life-changing experience. For me, I just was chronically ill from the time little, as early as 3 or 4 years old. I just was always sick, and I used to have to take allergy shots, and I learned by the time I was in my 20s, I learned how to give them to myself and chronic bronchial and sinus infections. And it wasn't until I started chiropractic care at the age of 29 that I got healthy. And for me, it was such a huge deal because I couldn't go outside on a beautiful day without risk having an allergy attack. And all of a sudden, within 6 weeks, I'm feeling great. And I went for back pain. That was my introduction. Would you say that that's true, that most of the people that you've seen come to you for back or neck pain, or do you see that people are coming to you
More
because
so
they've
in the
heard?
past, being in it almost 41 years, I've seen a big transition. At the beginning, it was all about back pain, and every insurance company paid for it back then. So there was very little. very little to convince somebody to do it because their insurance company paid for it and they had to pay very little. But back when you were talking about people that became chiropractors, back when we became chiropractors, when I became a chiropractor, it was like all miracle cases, like I had people say, "Oh, why'd you be a chiropractor? You're a smart girl. You could have been a medical doctor." But so back then it had to be a miracle, that brought us to chiropractic. Now it's just a good career choice.
Right.
That is, that's changed over the years. And now the pendulum's actually swung a little bit back in a sense, not just for chiropractors, but for all the healing arts, because people want to work from home. So it's hard to be a chiropractor from home.
Right.
So their chiropractic education is a little bit flat now and all healing arts aren't as desirable because people don't want to go to work. They want to work from home. So there's been a big change. You didn't mention and a big part of me is that I was on the board of trustees at Life University for 14 years. So I watched the trends and I practiced less than a half hour from Life University. And I have two of my four kids are going to graduate next year from Life
Oh,
University as chiropractors. So
that's
I
awesome.
find the education because I remember when I went to school, they said how many people have never been adjusted and some hands went up. And we were shocked that hands went up. But now it's the same thing. I take care of patients in my office that kids in chiropractic school that never had been adjusted.
Right.
And it's a career choice.
So, how do you communicate how chiropractic works? If you were to meet, let's say we met on the street and, we just started talking. I guess asking that question kind of puts you on the spot, especially because if we met on the street, you would probably only have 2 or 3 minutes versus an in-house, new patient lecture. But how do you explain how chiropractic works?
When I meet somebody on the street, I don't know that I'm really explaining the chiropractic principle. My goal is to get them to come into the office, really. So that's where I have the time and the energy to explain it to them. At the beginning, because I still do spinal screenings, where I go out into the public. At the beginning, people just want to know that you care about them and that you are proficient and that you'll let them know if you could help them. And they want to know you're a human. More often than not, I'll tell them my chiropractic story before I'll start explaining about the nerve system because I connect with them. When you connect with somebody, you build trust. Again, now chiropractic is a lot more credible, but back in the day, most of the people that came to me never had been to a chiropractor before. So I had to build that rapport that they would trust me. So I never, I never was very aggressively teaching them what chiropractic is in the public. I might, if they say, I have migraines. Oh, I've had, my response was, I might be able to help you. I've had a lot of people with migraines. Come on in the office. Let's do a thorough exam and see if you have interference to your nervous system, because that's what I look for. Something called a subluxation. If you have a subluxation that's interfering with the transmission from the brain cell to the tissue cell, then I might be able to help you.
Right.
And at that level, not, you got to do what I'm doing.
Right. Um, so what
That's
are
what we
some,
want to say because we see the evidence of it. After this many years, I've seen so many people get well and even more stay well. And I'm watching the quality of life of people that have chosen to continue and have regular chiropractic care I'm so passionate about it. I actually have to bite my tongue.
you probably see generations of people, right? You have worked for so long in the field. Of course, you did start out in Pennsylvania. And how long have you been in Georgia now?
15 years.
Okay.
I sold my last practice in Pennsylvania about 8 years ago, and I actually am in touch, pretty close touch with three of the doctors in particular that I sold practices to that give me feedback, and I'll get texts all the time. So and so came back. The police chief, he's 83 now. He's asking for you.
Oh,
They're still, looking for that connection. But then there's people that have been under regular care. And when I say regular care, I don't know how much you want me to explain, but basically most of my patients come in with pain But once they are out of pain, regular chiropractic care is somewhere between once a week and once a month to stay well. And that's what most of my people come. They're not sick anymore. Matter of fact, they're healthier than most because they keep their nervous system tuned up. That's what we do. There's something called a subluxation. A subluxation is when a bone goes out of place or somehow interferes with that transmission. And that's caused by a whole bunch of things. It could be caused by a physical trauma, emotional, it could be caused by stress. You know, when your ears are around your shoulders and it can pull those little bones out of place and put interference. So we look for something called a subluxation. And in the office, so I talked about how you get the person in the office, but when we get them in the office, a lot of what we do is just share with them what it is that chiropractic is, because it makes so much sense. I actually have a poster that says the simple truths are put here to confound the wise man. And one of the big, and I'm sure you've heard this, there used to be a chiropractic college called ADIO, above, down, inside, out, that healing comes from above, down, inside, out. And by adjusting someone, if someone has nerve interference, then their body's ability to heal increases. They might not feel better right away, but they'll heal better. As soon as you take that pressure off, they start healing. I always tease patients, they're going to put it on my gravestone. It's going to say, pain moves around before it leaves. Because
Yeah,
very often, here's another one. I made this one up until you tell me someone else says it, but it just made, it made sense to me. Is like we work with the body you take to the gym, not the drugstore.
right.
So every adjustment builds on the last. And all of this has to do with giving people a choice of building their body from the inside out rather than looking to treat their body from the outside in. It's like for years, we did what we could to stay healthy, and then we didn't feel good, and we threw the card down on the doctor's table, the Blue Cross card, and said, "You fix me." But we
Right.
know that's not really how it works. We're self-healing organisms, and people know way better than they used to how to eat right, how to exercise, how to be sleep right and take responsibility. I mean, not everyone does it, but the knowledge is out there with the internet. It's an amazing information age we live in.
Now, during COVID, did you notice, did your patients still come to you for care during the whole COVID thing when a lot of people were scared to leave their houses and stuff like that?
Yeah, we kept on going. I actually adjusted people with COVID, but not while the office was open,
Hmm.
because of people, and we did, we masked up and, took precautions at the beginning of the epidemic, obviously. But I didn't have any patients die of COVID. I didn't have, most of the people that you see that goes into, this can get controversial, but if your body is working, why did some people die of COVID and lots of people didn't die of COVID? And it had to do with how well their body, they called it pre-existing, or they called it morbid COVID, like they had something going on and they found out when their body couldn't fight COVID. The regular chiropractic care builds your resistance up so you don't get sick as much. And if you get sick, your body can adapt to it better. When my kids were growing up, I adjusted all my kids from birth on. And people would tell me all the time, "You're so lucky. Your kids have never gotten sick." Or a patient would say, what do you do when your kids have an ear infection? I don't know. My kids had an umbrella. You go to take them to preschool, and one day there'd be 20 kids, and the next day there'd be 10 kids. But my kids were always the ones that were there. They were the ones that had higher resistance. Their body could adapt to the world. Just here in Atlanta, a couple of weeks ago, it was 70 degrees. Then last week, it was 20 degrees. Today, it's 60 degrees. Tons of people are sick, not because of a germ, but because their body can't adapt. And the germs, which are all around us, we live in germs, then their bodies, if their resistance is down, then they can get sick. It's like if there's, I used to practice in the Poconos, and there were deer on the side of the road, right? And if you look close, there were usually flies around the deer.
Right.
And if you came here from another planet and looked, you would think that flies killed deer. But that's not what happened. The deers were dead. They couldn't go like this to the flies. So the flies go, come on, guys, we're having a picnic. Same thing happens to our body. If our resistance goes down, then the cancer cells, we all have cancer cells in our body, or the viruses or the bacteria or the COVID or the flu or the pneumonia, all of a sudden we get those things because our bodies can't fight those things.
Right. I think I'm pretty sure that we all in my family had COVID in January of 2020. We had just come back from a wedding, and the three of us got, my husband, my daughter, and I, we all got very sick. And, within 7 days, we were fine. And because I was sick, I was, of course, still adjusting them, but I wasn't going out to my chiropractor to get adjusted. But still, within 7 days, we were done. And all during COVID, I saw patients that had COVID, active infections, and I never got sick again. It's that there's that thing called natural immunity, right? And having a strong immune system. And, here it is, February 2025. I don't think I've been sick once since then, and neither has my husband and my daughter. They get regular chiropractic care, and now there's this bird flu and, all this other stuff. And I think it is important for people to understand how miraculously our body has been built, the creation of our body and what it can do. And when I used to do talks in my office, I used to love that example of when a sperm meets an egg and it comes together and it creates life and the way it multiplies and then, creates the liver cells and the brain cells. And we can't replicate that. Scientists haven't been able to replicate what, nature has given us.
Yeah. That's very true. That's why every year there's new surgeries, there's new medications, because they're evolving, because they're figuring out from the outside in how to fix this body. That's the beauty of chiropractic. If you have an interference to your nervous systems, there's never a case where you're better off to leave that interference there. So I don't know how to make an eye tissue or a liver tissue. I know a patient had a symptom. Sometimes people have symptoms, they think it has nothing to do with chiropractic, and they don't tell you about it, and then it goes away, and they're like, how did you know that? And the answer is, you don't have to know that. I'm talking about, this woman had polyps that went away. You don't have to know that. You just have to open everything up, and that body's ability to heal increases. Interesting thing about COVID, people get COVID all the time now, and it's not like, oh my God, you have COVID. It's not like a death sentence. At the beginning, since it was new, it was a lot more to adapt to. But now COVID is mainstream, just like the flu is mainstream in the flora of the world. So that when you get COVID, it's not the same strain as it was, and your body doesn't have to adapt as much as it did when COVID first came out.
Right.
If I in getting adjusted regularly again, and I don't want to repeat myself, but it's really what my life is about, because I just have to witness the body's ability to heal itself. Reggie Gold used to say, "Don't forget, innate's last name is intelligence." That intelligence that took those two cells and came together late on a Saturday night in the back of the Chevy doesn't leave. It makes that into 4 cells and 8 cells and 16 cells. When that baby is born, that intelligence doesn't leave. It kicks in. And that's how the baby thrives. It knows to go to the breast because it has that innate intelligence in it.
Right.
So what we do when we care for our body, we should be looking at having that enhancing that intelligence, not dumbing down that intelligence and trying to treat the body from the outside in.
Yeah. And, it also speaks to, what a fever is. Like, what's the purpose of a fever? The fever innately, like the innate intelligence of the body, knows that if there's a virus or bacteria that's invaded your body, it will increase the temperature to kill it off. So, and we all have this innate intelligence. But again, our body will work better if we're allowing the nervous system to work freely and not have any kind of, interruptions to that nervous system. Um, so I just want to share a couple stories with you in practice. One of my patients, she was trying to avoid, she wanted to do a VBAC. She had had two cesareans previously. And, this was actually when I was living in Pennsylvania. I used to live in Phoenixville, and she was at a hospital close by. And I wound up adjusting her in the hospital because the labor had stalled. And, the nurse midwife was saying it was probably going to be another 10 or 12 hours. And I went there and adjusted her, and she had that baby within like an hour. It was amazing. Just turned everything on the way it was supposed to. The power was on. The baby came out. And it turns out the baby had Downs and had some very severe breathing problems. And she calls me up like a day later that the baby was in the NICU, and would I come over and adjust the baby? So the baby was on this, oxygen, and I'm holding this baby and watching the numbers go to normal, from the monitor. And to me, that was like one of the most incredible things I've ever experienced, to see this baby just like really expressed life fully. And, the baby went home like a day later because the baby got what it needed. And I'm sure you've talked about birth trauma and how important it is for, you know, brand new babies to get adjusted. I assume you talk about that with your patients.
That's one thing that has changed. I don't know if it's because I live in the Atlanta area, but I get pregnant women all the time that are told. I get referrals from midwife groups all the time, and it's very normal. Like when you get pregnant, that you should get adjusted. Um, because we were talking about before, we used to get people with back pain. Now I get people very often that are pregnant, and when you're pregnant, your ligaments, everything loosens up, and you have this baby in front of you, and your body has to so much more to do. And getting adjusted, I had twins. My twins are now in chiropractic school. I have four kids, and I had home births, and got to got to see the miracle of life and what a miracle birth is. It's not a diagnosis. It's not something to fear. We so have been disconnected from our bodies that we fear that something's going to go wrong. And one thing in learning about chiropractic and living this inside out life is having that trust in the body. I remember my kids were in sports, and like often they would get dehydrated and they'd get headaches. And my one daughter in particular, I'm thinking about, and so she'd say, "Mom, I have a headache. Would you adjust me?" And I would adjust her, and then I would tell her, I'd give her a big glass of water or whatever, and then say, "Go lay on the couch, relax." And later on, she said to me, she said she never considered, like to this day, that maybe, because now her boyfriend or people will say, "Oh, why don't you take a couple Advil?"
Right.
She never even considered that. She said, "Oh, I messed up a little bit, and my body's giving me symptoms. So how can I take care of that?" That's a chiropractic way of thinking about things, thinking about it from the inside out rather than, oh, headache, what can I do to treat that headache from the outside? But the funny part of the story is that she, to this day, if she doesn't feel well, she has to lay on the couch and drink water. And actually, earlier today, I swung by her house and adjusted her because she's in midterms. But it's such a gift that you give people. You give their body back to them, because they're taught, again, you throw the Blue Cross card on the table, you fix me. In chiropractic and looking at life from inside out, all of a sudden all the fear turns into faith. You get to witness, it's like when you get a paper cut, it's not the Band-Aid that heals the finger. It's something, and the way you test is you take a dead person, cut their finger, nothing's happening, right?
Right.
We cut our finger, and before we even know it, we have the paper cut, or it's already healing. The scab is already forming. The body knows how to heal itself from the inside out. That miracle is something to bank on. Now, there's times for drugs and surgery and all that. I'm not saying, if you got, I think you got to, if you got hit by a big yellow bus, don't come here first.
Right.
But but it's amazing how little, how scared we are. And that's one of the things, and I don't want to talk about COVID a whole lot. I don't like to think about it too much, but that's one of the things that that blew me away, about that whole thing, how scared people were.
Right. And still are. Some still are.
Oh yeah, I have people that come in and they have a mask on, and it's because they have a cold and they don't want to give me the cold. If
Right.
we don't expose ourselves, that's how the immune system builds up. I remember when my kids were little, if somebody had the chicken pox, I would send my kids over so they'd get the chicken pox. So it's like a muscle. You build a muscle by using it. So they would be with they'd get the chicken pox and they would build that immunity to their chicken pox that way. I remember when my first patient, Dan, he's still a patient. He works for Delta, and he was one of those first generations, got the COVID right away. And my daughter looks at me. My daughter runs my office. My one daughter isn't a chiropractor, but she's my does everything in here. And she says, "Mom, are you going to make us go over to Dan's house?"
But yeah, one thing I also think about is that I'm wondering, because you are still in practice, are you seeing more like sick people? Like, I wonder the effect of, fluoride and, people that take a lot of medication and the stress that I feel like the stress is much higher than it was 20 years ago. I'm in my mid 60s, and I just feel like things are just harder now. And now, there's like more political stress, and I have to think that it's affecting more people than maybe 20 years ago. And things are more costly, right? So
Yeah.
so and I have seen people detox just from getting a chiropractic adjustment, which is amazing for me, because before I saw that, I thought, oh, I need to do all these detoxification protocols and, do the foot bath and this and that. And one day I was working with a girl, I think she was about 3 years old, and she had a severe reaction to one of her shots. And the mother just brought her to me out of desperation. And I adjusted her, and, like major poop coming out of her and sweating. And, the mother was scared. I'm like, just trust that your daughter is detoxifying. She's getting rid of the toxins from the shot that caused, her to have this reaction. And, to me, that it just reinforces not only how miraculous our body is, but how wonderful chiropractic is, because it will allow the body to heal if we just give it that chance.
Absolutely. And there's also, when you talk about, I mean, I've been pooped on and thrown up on, you know, but the emotional release, when the nervous system is unlocked, you know how they say you're on your last nerve? When an adjustment is properly given and that nervous system relaxes, I've had people leave laughing. I've had people leave crying. When I was in the Poconos, I had a nurse who was a patient who put on the in-service day. She was the head nurse for the 14 schools. And every year she'd have me come talk about chiropractic. And we would actually take care of a lot of kids with ADHD, and we would intentionally do it right before the summer because that's when, if you take them off the medication, obviously they're going to be crazy for a while, but a good percentage of them at the end of the summer didn't need to go back on medication because their brain chemistry normalized, their bodies normalized, and they didn't need it anymore.
Yeah.
So I got to tell you, I don't know, you say you have a daughter, Nancy, do you have any grandchildren yet?
No, she's 21. I had her at the
Oh,
age of 45, my
Oh,
one
okay.
and only. Yeah, she was my miracle baby.
Oh, I started a little. I mean, I was 35 when I had my twin. So, and my one daughter started having children pretty young. She was a senior at Kennesaw State, and that was about 8 years ago because her oldest is 7, and she has 4 little boys.
Wow.
Yeah, so I have 4 grandsons, and I see them every week, and they have an adjusting table in their living room. It's a portable, and when they see me driving up the driveway, they fight to put it together because they want to get adjusted first. They want to get their spine checked first,
I,
and
it's funny you say that because frequently, when I had a regular practice, I would always talk to parents about bringing their kids in, and they would bring one in first, because they couldn't understand, right? Like they couldn't really understand how important it
well,
was,
this is definitely putting a square peg in a round hole. I mean, the whole idea of going to the doctor, you know, how it wasn't that many years ago. You would only go to the dentist until when you had a toothache. My
right,
mother never went to the dentist, and by the time she'd go, they'd pull it out, and then
right,
became preventive dentistry, right? And
yeah.
and we've been about preventative chiropractic, but you can live without your teeth.
Right. But the funny thing is, you start adjusting one person in the family, and then there's a cold, right? And everybody's getting it except for the person that's getting adjusted. And that, or let's say, as you said, they go to daycare, they're at school, and your kid is the only one who's not getting sick. Or, and then all of a sudden, so what would happen is very early on. So when I first started in chiropractic, I was more of a sports chiropractor. And I think it was around 97 that I saw Jeannie Ohm speak, and that was it. Like it became pediatric and prenatal chiropractor. And I remember early on that I'd have, working with more sports injuries, sports chiropractic, and somebody said, everybody else in my family's getting sick all the time, and I'm not. This is like the first time. And then all of a sudden, they would bring their whole family in because they got it because they saw it firsthand. But the other thing I was going to mention is, sometimes with kids, they're reluctant at first, but then all of a sudden, within a few weeks, they're fighting over who gets to go first, right? They all want to go first. So it's just kind of funny to, see that.
Yeah, it's a difficult road in that, like, if my kid gets sick or my grandson gets sick, my daughter can call me and I can talk her off the ledge and say, give him some water and put him on the couch, right? But what if the in-laws or the spouse don't buy in? There's a buy-in to understanding a different, be it chiropractic or eating healthy or, whatever it is that you're doing that's outside of the norm. You end up having to be an anchor. So I think it was BJ Palmer who said, you can't anchor to an unanchored mind. I'm the anchor in my office. And what I've created over the years, and I've done it several times, and the reason I've been able to create so many big practices is because I create a whole little world. I remember when I got out of school, I worked for Jim Sigafus, so I'm sure you know, and he had a poster and actually on his letterhead, I used to use stationery back then. It said the Mecca of chiropractic, and I was like, oh my God, give me a break, the Mecca of chiropractic. But you know what? Our offices are the Mecca of chiropractic. Our offices are the Mecca of this inside out way of looking at things. And the stronger our anchor is and the stronger our need to serve people, the bigger our practice gets, because people need what we have, and we've got to get outside of ourselves and make sure we're in good condition so we can deliver the goods to other people. Being healthcare providers ourselves, we have to be examples of that, and then we also have to be able to communicate, and that's so much of what we do. We do lectures for our patients. When a person first comes in the office, before I even do their case history, I explain what chiropractic is. Matter of fact, I'm in my consultation room right now. Here it is. I I explain the brain sits up in here. You know, you can't, it's protected by one solid bone. The spine is separate bones so that you can move around. But if those bones because those bones have mobility, they lose stability and they can move out of place. And if they move out of place, they can cause interference. And if you look above me, is actually, there we go. A poster that I created to show them some of the ways they get subluxated, because the more often they take care of themselves and not get subluxated, the less often they have to come see me.
Right.
And to take that responsibility to not lay on the couch with your arm above your head, or not to sit there and text your neck all the time, look down at your phone. I tell patients this is a participation sport.
Right.
And it empowers them. It empowers them to know that there are things that they can do to make themselves healthier.
So,
And
what?
I still, I didn't answer that other question. I just want to get back to, I still take care of a lot of kids, but I'm closer to a city now. And I tease that my patients don't have custody, or they're coming from work. But it seems harder, and it seemed easier when I was in the Poconos. I think the people, did things as families more back then.
Right.
Now I get them to stop on the way to soccer, between soccer and, band practice.
Right.
Like everyone's running, running, running. But we used to be years ago, going to get adjusted was an event.
Yeah, things were not as crazy busy as they are now. And then, if the parents got three kids and they all have different, extracurricular sports activities, they're just going and going. And I think it's really tough for parents these days as opposed to 20 or 30 years ago. That's the way it
That's
feels
when
to
they need
me.
us more. And
Yeah,
that brings me to my favorite topic, which I haven't really talked about, which is not a chiropractic subject. It's just a subject, which is love. Like people, when they walk into my office, from the minute they walk in the office, they feel that unconditional love. When I first got into practice, they told, I had these rules. If you didn't, follow my care plan, if you didn't do this, you didn't do that, you couldn't be a patient. And now, since I had kids myself and I've learned unconditional love, let me tell you, they've tried everything to get me to not love them. But now I just love them, whether they do my care plan, they don't do my care plan, they have an insurance company that's a pain to deal with. I don't care. I'm not going to stop loving them. And I can't tell you how many times I've taken a person in the back, x-rayed them, taken them out to the front to make an appointment to come see their x-rays, and they're like, I feel better already. Just being in the energy there, I'm like, I do nothing to you yet. But just being in a place where I'm not afraid, and when I show them their x-rays, I show them what's wrong, but I also show them what's right. And
right.
I give them hope. How many doctors give you hope anymore? How many doctors love you, smile at you, look you in the eye, touch you on the shoulder? I remember they used to say chiropractors have it easy because, their patients, they get to touch people. So they bond with them. Yeah, I bond with people. I put my hands on them. And I'm able to make their life better with my hands. I touch them and I can release their body's ability to heal. That's my magic power. I mean, I don't think it comes much better than that. I couldn't imagine. I have a lot of friends. I have a guy worked for me. He's a great chiropractor, and he retired. And he wrote a book, and he wanted me to write his little thing. But I remember when a little thing about it. But I remember when he first called and told me he retired. I'm like, quitter. Patients ask me, are you going to retire? I'm like, I am. This is it. This is who I am. I eat, drink, sleep chiropractic. I love chiropractic. There's nothing I would rather. I'm starting to practice in less than an hour. I can't wait for the first person to walk through the door.
Oh,
I
wow.
get to do this, and nobody can say, oh, you're too old. You got to retire. I don't have to retire. I love what I do, and whatever's good for you, Nancy. I remembered you retired. I didn't mean it to you. You found a way to make to make a difference. I found there were many years where I was on the road 40 weekends a year speaking to chiropractors and training students. And I still do. I take in interns from life. But I love what I do. And I remember my one daughter that didn't want to be a chiropractor, she came to me at one point. She wanted to be a teacher. And I was all for it. And she came to me, she said, "I don't think I want to be a teacher." I said, "What do you want to be?" She said, "I don't know, Mom, but I want to love going to work like you love going to work. Like,
Right.
like you are your work. It's not like that's something you do for a living. You're expressing who you are when you tell a patient when to come back in, or you tell a patient to bring their kids. That's who you are. That's what you're doing. It's not about money. It's about me being able to serve, and to find a profession where you can go in and serve people and you can go make a difference. Forget about it. It don't get no better than that.
Exactly. Because then you're not really working. You're not working, right? You're just doing something you enjoy. And that is actually one of the reasons I wanted to interview you for my podcast. Even though we've never met, I've just heard so many amazing stories about you over the years. And, clearly you just love what you do. And I wanted to be able to share that with other people. I wanted people to learn about you and, the way you love chiropractic. And as I said, to me, it doesn't feel like you're going to work. You're going to play.
Oh, absolutely. And I know, I don't care how many patients, I don't see as many patients as I used to, but every day I'm changing lives. It doesn't matter how many, and that's the one thing that has changed. And then I don't want to be in the business. I don't make near the kind of money I made when I had a half a dozen doctors working for me, and I had different locations, and I had other ventures and real estate and all. I have like the simplest life. And that to me the simplicity of being able to do what I love most is that is I wouldn't trade that for all the money in the world. I don't have that much more time to spend all the money in the world, but I could still, every year I still send kids to chiropractic school. They come in the office and they're patients, and I say, "Hey, do you ever think about being I say that to everybody, no matter how old they are. You ever think about being a chiropractor?" And they're like, "Really?" And then I get into a conversation about them, and you know what usually comes out of it? I want your job.
Right, right.
I want your job. Something is very right when people see what you do for a living and they want your job.
Well, Dr. Gorman, I just can't thank you enough for sharing your love of chiropractic and, just sharing who you are, because I think that I'm hoping that more people will decide to try chiropractic and maybe even become a chiropractor themselves.
Well, tell them to give me a call. I'll
I,
take them to lunch.
I will.
We can
Okay.
talk about it.
Thank you.